September is National Recovery Month, and if you or someone you know is struggling with addiction, we've got an expert in the house to help you on your journey and get you the care you need. The Health Source Podcast starts right now.
You are listening to the Health Source Podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Hello again, and welcome inside the Health Source Studios on the campus of Marshall University. This is the Health Source Podcast, brought to you by the Marshall Health Network. I'm your host, Rick Lord, and today we're going to be talking about a very important but sensitive topic, recovery and the care and treatment to get what you need to get and get where you need to go. And joining us now is an expert in the field, 30 plus years, as a matter of fact. This is Michael Haney, who is a social worker and the head of PROACT, which stands for Provider Response Organization for Addiction Care and Treatment. So I guess, Michael, just start off by talking about PROACT, what it does, and how it helps the community.
Sure. PROACT opened in 2018, and the idea originally was to be a collaboration between several different parties. We wanted to provide not just traditional treatment services, but also wraparound services, case management services, spirituality, employment services, things like that. And so we had 3 different agencies in the building, and that worked out fine until, of course, COVID hit. And when COVID hit, everybody wanted to kind of retreat behind their own doors to
they
stop
avoided
this.
hospitals and care and treatment.
Yeah, we were very concerned about the spread, and after that drug out for several months, the partners basically decided, we can continue doing what we're doing, but we'll just do it ourselves. So at that point, Marshall Health, with through family medicine, the Division of Addiction Sciences stepped in, and we started doing all the services that we offer at PROACT. And so currently we have traditional therapy services, medication-assisted treatment. We offer primary care services because we were starting to see that people were coming in that had illnesses, and we would refer them to a medical provider, and they would accept the appointment and then just never show up. It was, and I'm sure you, like I, have had doctor's appointments where you went, don't feel like going today. Yeah. But in their case, it was very important that they keep those. So we started doing those appointments in-house, and that way we could, increase the likelihood that they would follow up.
So, is that, and I don't mean to interrupt you here, but that is a very important almost challenge of what you do is balancing that, meeting people where they are, and also kind of nudging them and motivating them to get the treatment that they need. How do you balance that?
Well, in the old days, you used to always hear people in my field say, never work harder than the patient. That's not always true. At a certain point, yes, somebody needs to take more value in themselves than I take in them. But in the beginning, they don't know what recovery is.
Right.
They have no frame of reference. So I need to work harder simply to get that motivation going, help provide them a direction and help them figure out themselves what they want to do and which route that they want to take. So the balance is really kind of let the patient be the guide and see what they need.
Yeah, and you talk about all the services that you offer, and that's a valid point because it is such a comprehensive, complex issue that it needs comprehensive care. How important is it to you that you offer all these different types of approaches and can maybe tailor them uniquely to each specific person?
It's very important. Every person, addiction is very similar across the board, but every individual is different.
Right.
So their situation is different, their needs are different, their strengths are different, their weaknesses are different. So as long as you can tailor what they need, going back to your question about services, one of the things that we offer, we have something called Creating Opportunities for Recovery Employment. And once somebody has entered into sustained recovery, it doesn't even have to be very long, we will start working with them if they're interested in finding them work. And sometimes that can take the form of helping them fill out a resume, getting them clothing for their interview, up to and including actually getting them placed in a job.
Yeah. And how do you compartmentalize all this? Because when you're dealing with addiction, number one, there's possibly a mental health issue involved in that. And so beyond that, it's tough to see the forest through the trees when you're involved in that. It's tough to say, okay, it's overwhelming, right?
Yes.
Where you have to go and all the things that you have to do and all the little minutia that goes into that. Like you said, getting a job or stuff. I kind of equate it to my toddler. Like when I say clean this room, he freaks out because it's a big room. But if you say, okay, pick up these toys for, I mean, is that kind of your approach? Does that succeed in compartmentalizing it and trying them to do like one thing at a time?
Yeah, absolutely. You want to stabilize the person first. So really, the first thing that somebody does when they walk in the door is they have an assessment with a therapist. And then that therapist will sort of see the scope of the problem and make some suggestions as to the things we can do. Let them know of the services out there, not just with us, out there in the community.
Anywhere, yeah.
We've had some people travel as far as Logan to see us, and we're happy to have their service, but maybe we can get you into a place that's actually more convenient, because if it's more convenient, you're more apt to follow up. So once they get an idea of the scope, we can start working with things, and we get them stabilized in the recovery. We can start to add things on. So sometimes it's small things like, hey, I'm not going to get you stabilized in your recovery unless you have housing. So let's help you with housing. In the meantime, while you're working on the housing, you can still keep coming to us. Once you get stable, hey, are you interested in a job? We can work with you on that. One of the things that makes us very unique is we have a board-certified chaplain from St. Mary's who offers spiritual care. Okay. It's not something that people are required to do.
But it's there for them if they want.
It is very much there for them. And there's a lot of people, especially in this area, that is something of interest to them. Their faith is a large part of their motivation.
What would you consider some of PROACT's greatest accomplishments? I mean, you've been at it a long time, so the list is probably long. But if you could just pick out a few, and we don't need to get specific because we're probably some HIPAA laws in effect here. But just like in general, what are some of the things that you've done?
One of the things I think that we have that's a big thing for us to do is we do same-day care. Now, before I started this job, I was at another place that tried very hard to reduce the time to get into services. And there was absolutely zero way to get it down to zero until you just do it. And so when I started here, the wonderful thing about working in family medicine, while Marshall Health has done some behavioral health things in the past, they've never really done a deep dive into it. And family medicine certainly had not done behavioral health. And the great thing about that department was I found that you didn't have anybody saying, this is how we've always done it, so you have to do it this way. I was basically given two directives: make it work, don't break it. So I have done so far, I have been able to make it work and not break it. And so when the idea of same-day access came, we just started saying, hey, come in, we will see you. And we just made a point that as long as there was a therapist in the building, I mean, you might have to sit for an hour until they're free with their group or their individual or something, but somebody will see you that day. And we went from that to then you will not only see the therapist, you'll see the doctor the same day. Sometimes you don't realize things are possible until you actually just
do it and see what happens. You mentioned COVID. The opioid epidemic, also an enormous barrier, I'm sure, for the work that you do. Have you seen any progress on that front in West Virginia and in the region as a whole? And where do you see this headed?
Well, before COVID, we saw a steep drop in the overdose rates, which, I'm not going to say it was just us because there was like a full court press on the whole thing from all areas. But we were seeing a drop in the overdose rates. When COVID hit, when everybody retreated behind the doors, we encouraged people to not get out and socialize. And unfortunately, recovery is very much a social.
Yeah, that isolates you.
Yeah. I mean, you need that support system. And so we started to see those overdose rates climb back up. Now we're starting to see them come back down again. But it is always a struggle. People have a lot of choices out there. Not all treatment centers are equal. I'm not going to say that we are the best that ever was. I think we do excellent work, and I think there's several out there that do excellent work. But it's important that people take ownership of their patienthood, of their recovery, and find something that's actually going to help them rather than just placate them.
And honestly, that's the mark of someone, an organization that truly does care, where you're like, okay, well, we'll try to help you, but if we're not right for you, we'll find something that is, because it's not about us, it's about you. And building trust is such a key component to all of this when you're dealing with people that are struggling with addiction, and then figuring out what avenue is going to work best for them. What's your approach to that, to building that bond, and then to figuring out, and how do you figure out where you're going to take them?
The bond is just, I mean, really, it just comes with doing what you say you're going to do. One of the things I always actually say that our building is one of our team members. We have a very, very nice facility. And I have worked in places that have had a lot of caring people, a lot of motivated helpers, but didn't have a lot of money. And it was, I mean, I worked in a place once that used to have duct tape on the carpet because they couldn't afford new carpet.
You do what you got to do.
But everybody there was genuinely committed to helping.
Yeah.
But when people come in and they see us, they actually feel like, I mean, you're treating me seriously. You're treating me seriously. You're treating me kindly. You're actually talking to me about my issue. You're not saying, oh, you need to do this, this, and this. You're talking to me about my options. Yeah, you are saying here are some things that will help you, but you're also you're not hearing people say, but if you don't do it our way, there's the door.
Yeah, and humanizing these people is such a big part of the process, I'm sure, and because there are stigmas involved in all of this. What are some of the biggest barriers that you've seen to getting people the treatment they need?
Probably the two biggest barriers I can name off the top of my head are transportation and childcare, because you have a lot of parents that don't really have childcare, and it's very difficult to provide treatment when their children are there.
Right.
We tend to make an exception as much as we can. It's a little bit chaotic sometimes when the children are there, but I would rather have it chaotic and you there than it be calm as can be and no one there.
Right. To say you're a people person would probably be an understatement. I mean, it's in your blood. This is what you do.
At this point, I have to be.
But yeah, but what's inspired you to do this?
I just fell in love. Like, I mean, I had told you before the show started that I kind of fell into this by accident. I originally wanted to do law enforcement, but I was the first person in my family to ever go to college. So I had nobody really to say, hey, you need to think about this or think about that. And my college advisor, wonderful guy, probably didn't always give me the best advice. But so after I graduated with my bachelor's, I started looking for work, and a friend of mine said, hey, Pathways is hiring. And I went, that's cool. What's Pathways? And it's a community mental health center in Eastern Kentucky. And I started working there, and my first job was working in a crisis unit. So you dealt with everything. You dealt with the chronically mentally ill. You dealt with substance abuse. It was interesting. And it was, I mean, and you mentioned about humanizing. You saw people that was, and they were people. They were not people that you were afraid of or nervous about. They became people.
Yeah, and it's your family.
Yes, very much.
And speaking of which, family and friends are it's important probably to get them engaged in the process as well. How do you go about doing that?
So a variety of things. You definitely want the family involved because the family is the primary support system somebody's going to have. We tried a variety of things, so we are still looking for ideas. We tried to do like a family group before, and unfortunately you have a lot of people just not wanting to participate. Yeah. And again, it's the stigma. Either I don't want to admit that there's a problem, or I don't want to go to that building because that building will show that there's a problem.
Right.
So you try very, very much to work with the patient to get them to include the family, so we can reach out and talk about the things that the family needs to do.
So we talked briefly about the mental health issue here too, that oftentimes is part of the whole cycle. How do you integrate mental health care in what you do? So
we have a psychiatrist on staff. He also just does normal medication-assisted treatment, but he's a board-certified psychiatrist. So he is there 1 day a week, and if we have patients that we identify that there is an issue, we try to get in with him. We have a nurse practitioner who is psych certified, so we will also try to get people in with her, and if all else fails, we will find a place in town and make a referral. There you go. You mentioned your first love was possibly law enforcement, and we were speaking before we started about the way that the two can kind of go hand in hand, law enforcement and social work. Mm-hmm. I found what you said very interesting. If you could share with our audience about your thoughts on, we've heard national stories about how some cities want to bring social workers in on that. But there is a difference, I think you put it very succinctly, between an emergency and a crisis. Explain that. Yes. So I had an old, my favorite boss of all time, his name was Bob Hudson. And he explained to me when we first started doing some work with the police, that there was a difference between a crisis and emergency. And when there's a crisis involved, that's what we do. But when there's an emergency involved, we need to get out of the way because those people are trained to do that job. And as far as going out with the police, I've done that before. And it can work very well, but it's got to work very well a certain way. You can't do it in the absence of the police. You need somebody who is a professional in dealing with those situations to clear the scene and make sure everything is safe. And then also, then professional enough after they've done that, just step back and allow the other professionals who are an expert in that area to come in. So it's really a team approach. I don't think you should ever not have the police and just have a social worker. I think that's just a recipe for a lot of injuries.
Could be. Yeah.
But if you have police who know that this is what I do and this is what they do and here's how we can make this work well. There was actually a group in Kentucky that they're based out of Louisville, I believe, and they used to go around to all the police departments in Kentucky and provide crisis intervention training. And it was a wonderful thing. I got to be part of it whenever they came to my area. And so it was a whole week where you train people trained officers, and this is what you may encounter. These are some tips on what you should do to address it. And it was great to see. One, just the rise in knowledge and education, but also people, they were taking it seriously.
Yeah, so certainly an outside-the-box approach. And you've been at it for 30 years now. Have you seen any recent developments or advancements that have you excited?
Sure. I think, I think the idea needs to be approached with caution and done correctly. I think the idea of including mental health components it's great because you often have officers spending a lot of their time dealing with situations that really, once it's deemed safe, there's other ways to put those people in places where they're going to get better help.
Yeah.
I know Huntington has started their crisis intervention team that is going out and doing things like that. So, things like that I think are a great boon to actually solve a problem rather than just put a lid on it.
Yeah, and it would seem to me that if you keep an open mind and you're willing to talk with officers or people in other fields, that you can brainstorm together and come up with common issues that can, their advice could help you and vice versa. And when you talk about like police and emergencies and trauma, what role does trauma in general play in all of this, you think?
It is, I always say that if you have a substance use disorder, if you didn't have trauma going in, you're going to have trauma before you ever get into recovery because it's a very traumatic thing. You generally do a lot of damage in your life and to yourself.
And to your family and friends.
And very much until you can get some help. So being trauma informed, I think, is very important because you don't always understand what that person's been through. And if they start to behave a certain way, you don't need to say, oh, you're overreacting. No. Maybe they are overreacting, but they're not overreacting from their point of view. So you need to just kind of accept, this is how I'm feeling. Step back and let's work our way through that.
There's a chance that someone watching or listening right now has someone very close to them that might be struggling with addiction. Do you have any specific advice other than get them help? Do you have any specific advice for them how to handle the situation right now and how to steer them toward the right conclusions?
I would recommend honesty, but maintain your boundaries. I always have an excellent story I always tell. Kevin Smith, the actor and director.
Sure.
He tells a story about his friend Jason Mewes, who was in active addiction for several years. And he realized at a certain point, because he had just had a kid, that he couldn't have Jason come around all the time. Right. But he never stopped being Jason's friend.
Yeah, and if you don't know who Kevin Smith or Jason Mewes are, go rent Clerks or find it on video on demand. That was one of Kevin's first movies.
Absolutely, and it was. But I thought that was a kind of a great blueprint because he maintained that boundary. He said, "Listen, you can't be around my kid while you're using, but hey, I'm still your friend. I still love you. I still, I'll do what I can for you. I'm just not going to support your addiction, I'm not going to let your addiction affect the people around me." And so I would recommend that families do that. Love your loved one, offer them some guidance, But depending on the situation, keep those boundaries up so that you make sure at least that they don't impact you and those around you more.
I said rent, like Blockbuster still exists, right? I'm showing my age now. I don't know. People are like, rent a movie. What does that mean?
You can rent from Amazon.
There you go. So it's still out there. You just got to look for it. So how has your job in the last 20, 30 years, how has that kind of changed your personal perspective on recovery and care and treatment?
Very, very much. At one time, I was very much against medication-assisted treatment. And I remember having a conversation with a friend who had worked in a medication-assisted treatment clinic. And of course, I was doing a rant about, how I used to clean up the messes here, and used to clean up the messes there. And she was very kind, very patient with me. And she finally said, have you ever met somebody who was successful in medication-assisted treatment? And I said, well, no, I have not, which I thought was kind of the cap to my argument. And she said, well, why would you? Because she said, your job description is to clean up messes. Because at that time I was working in a hospital. She said, you're not going to see those people who have been successful. You're only going to see those people who are struggling or have failed. That's true. It's kind of like the police. All the police, deal with are criminals.
Good point,
And it really made me think. And then I immediately started working in a job, by sheer coincidence after that, where we did not prescribe medications for treatment, but we would provide therapy services to those going through it. And I got to see a lot of people not only be very successful, but I saw families reunified. I saw a lot of success stories. And so when I came to PROACT, a large part of what we do is medication-assisted treatment. Even more so, but I came with a new idea that, this is a tool, this works, but like any other tool, this has to be monitored by professionals. And so we have a lot of great doctors that will work with the patients and talk to them about, what they're going through, what we can do about that, what kind of symptoms they're having so we can adjust their dosage to match those symptoms so that you don't walk out high or under the influence, but you don't feel sick. And therefore you feel more motivated.
That's great. So if someone's watching or listening right now and they're like, okay, I'm motivated, I'm going to do it. What's the best way for them to get in touch with you or someone else in the Marshall Health System and start that road?
They can always call us at 304-696-8700, or they can just walk in the door. We take walk-ins from 8 in the morning until 3 in the afternoon.
And where would they
Friday.
go to do that?
That's at 800 20th Street.
All right.
Here in Huntington.
In Huntington. So, and if you're not in Huntington or if you're watching us from anywhere else, there are facilities near you or there are people that you can get a hold of. So, the most important thing is to try to get that help no matter where it comes from.
Very much.
All right, Michael Haney, thank you so much for your time today, sir. We appreciate your insight on what is National Recovery Month here in September, and we thank you for joining us again. Remember, if you're listening on Spotify, drop us a like and subscribe so you'll know when the next episode hits. We're always here to help you and bring you along on your journey toward wellness. For Michael, I'm Rick Lord. Until next time, take care.
That was the Health Source Podcast, presented by the Marshall Health Network.